All right. So, Dr. Wu, thank you for joining me today, sir. How are you?
Very good, thank you. How are you?
I'm fantastic. So, our first question, sir. In the United States, we have a perspective on the Canadian healthcare system that it's kind of a socialized system where it gives universal coverage, but sometimes limits access to specialty care. There's very long wait times with surgeries, and that's something that we don't necessarily have in the United States. Could you speak about this as a family practice physician in Canada, how you feel your practice, for better or worse, compares to your counterparts in the US?
Yeah, that was something that I had to get used to in Canada. Definitely because of universal healthcare here. Sure, it's a lot of people have access to healthcare, but it can take a little bit of time. So it's not unusual for an MRI to take 6 to 9 months. It's not unusual to wait 6 months to a year to see a specialist. So it does put me as a family physician in a trickier situation that I had to get used to being in Canada as opposed to being in the States where things were moving a little more faster. And of course, I had other challenges in the States, but it was a different situation here. Being aware of all of the resources around here where I could send different patients to was definitely helpful. Telehealth here in Canada was started to become more well used, and that did open up access to certain different specialists, different resources out there. But still, I would have to say getting certain surgeries done, getting imaging done can still be quite a bit of challenge in Canada. I guess the big thing is for pain, right? If someone needs an MRI for the back because of ridiculous symptoms that they may have, even if I order an MRI, it could take months to get some results. And even if I do get a result and it shows that they have pretty bad radicular impingement or whatnot, getting back surgery done can take over a year to a year and a half here. It's being able to navigate that, being able to offer help to the patients. Those were definitely big challenges that I had to overcome here. That being said, because it is universal healthcare, I am able to see a lot more patients, all the patients, whether they have some financial burdens or not. It wasn't a big hindrance for them to come see me. So that was nice in that way. So there's pros and cons to both, I feel.
Wow, so it's true that patients will have to wait an extended period of time to get surgery done, huh?
Yeah, I mean, if something's really urgent and they go into the hospital to the emergency room, things can move quickly. But for elective surgeries, elective procedures, yes, they can take some time.
Interesting, very interesting. So, when you decided to go to Canada to practice medicine, was it difficult for you to get licensure there? Were there any issues with you having taken the COMLEX in medical school? Run us through that process.
Yeah. So if you wanted to do your residency in Canada, you definitely need to do your USMLE and not the COMLEX. But for me, I did my residency in the States and I was board certified in family practice. So all I needed was my American Board of Family Medicine, not the American Osteopathic Board of Family Practice. So I needed the ABFM to be able to go and transfer my credentials to Canada. That was the big thing, which in the beginning I wasn't aware of because I actually did my American Osteopathic Board of Family Practice first. I got that, and then I found out that it's not transferable. So I had to take the American Board of Family Medicine exam, get board certified with them, and then I was able to get that process going to transfer into Canada. The whole process, though, can take some time. I heard that they streamlined it now, so it's a little faster, but for me, I would say it took a little under a year to get all the paperwork done. There was a lot of back and forth communication with Canada that I had to do. The whole process, I won't lie, it was a little stressful. If your final goal is to come back to Canada, it is doable. It's just make sure you are ready to have a lot of back and forth communication and frequent follow-ups with the Medical College of Canada, Council of Canada, constant communications. Regarding school, I did not have to talk to AOA about it at all. Just make sure you have all your proper boards exams done or being board certified, and then it's pretty easy to come back to Canada. It's just the process could be a little long. That being said, if you're family medicine, I heard it's a lot easier to come back to Canada than if you're in another degree.
Okay, so quite a long process for you.
Yeah, yeah, definitely. But make sure it's important that everyone does their research on this because there are certain specialties where you need to do extra training once you get back to Canada.
Now, you're an osteopathic physician. What is it like practicing as a DO? Do your patients know what a DO is? Are there other American trained DOs, so to speak? I know that in Europe, DOs have a limited scope of practice, only being able to do manual medicine. Are there any European DOs that you've met in Canada? Do they have any osteopathic schools in Canada? Has there really been any confusion among your patients, given the fact that you're a DO?
Yeah, definitely a lot of confusion. Not so much anymore because I do have my patient panel right now. But when I meet new patients, every once in a while that does come up. So you're right. In Europe, the European osteopaths are just manual practitioners, right? Their schooling is, I think, 4 or 5 years of just OMM. In Canada, they do have a few schools that model the European schools. And so they do 4 or 5 years of just manual practice schooling. So a lot of rigorous training in that way, but they don't have any medical background. I mean, they don't have any medical education during the schools, during the schooling process. So there's those schools. So when I have a new patient, every once in a while, some patient sees that I'm an osteopath. And if they have extra like third party insurance and the insurance covers osteopathy, I've had a few patients come to me and ask me for just a pure osteopathic treatment, which I don't have the opportunity to do so much of that right now. But when I can't, I would give some osteopathic treatments every once in a while, like an extensive one, just like how a manual practitioner would do. I probably won't do that here. There's been a lot of confusion that way. So there was definitely some education that I had to give to a lot of people, telling them the difference about being an osteopathic physician and an osteopathic manual practitioner in Canada. Now, in Canada, the term osteopath, it is protected to osteopathic physicians. And those who are European trained or just a Canadian trained manual practitioners, they're the letter that they have after their name is DOMP as a manual practitioner. Yeah, so I still get a lot of confusions about that. But regardless, there is a shortage of family physicians in Canada. A lot of patients don't really care as long as they have a family physician.
Absolutely. In your day-to-day practice, does your degree come up often in conversation? I know you mentioned that you have a pretty
Yeah,
consistent base of patients
yeah.
now.
In the beginning, it has. It definitely has, especially if someone comes to see me for pain. That's probably the biggest time it comes up. Right? When I feel like their pain is purely musculoskeletal in nature, and they're asking me for, can I get an MRI for this? Can I get so and so for this treatment? Can I go see a surgeon for this? Then I try to explain to them that's not always necessary, and I explain to them why, what I believe is going on from a musculoskeletal basis, and then from discussing with possible treatment options, my degree does come up every once in a while, and my history as an osteopathic physician.
Do you work for the government or do you work for private practice?
So I work in the public funded system. I guess that's the best way to put it. I wouldn't call myself a government employee, right? But the way I get reimbursed is, so the way Canada works, it's not a pure socialized healthcare system, right? So the government gives funding to the provincial insurance companies, the insurance group. Each province in Canada has their own insurance group. And I basically bill the insurance group and they give me the funding that they got from the government. Right. So, but I'm completely self-employed pretty much. Oh,
Okay. Now, to go back on my previous question, I've worked with some DOs before who have expressed that it wears on them being questioned so frequently. Do you relate to that at all?
sometimes. Definitely sometimes. It really depends on how busy I am at that moment in time. If it comes up early on in the visit, sure. I love educating people about the difference between allopathic and osteopathic medicine and the training difference and the philosophical difference. I love talking about that. I love talking about osteopathy. But if it comes up at near the end of the visit, more so like, oh, by the way, what's the deal about? That's when I'm like, come on. Why couldn't you ask me that 10 minutes ago? I love talking about osteopathy. And in fact, in Canada, it's not only with the patients, but there are some physicians who are not aware of DOs as well. Those that are just purely trained, who grew up and trained in Canada, yeah, there's many that I don't know what it is. So just communicating and talking to them about that, I just love educating people more about osteopathy.
So, Dr. Wu, could you walk us through a typical workday as a family medicine physician in Canada?
Yeah. So first of all, I work in two different settings. One of them is my longitudinal, my family practice, which is today, and I do that twice a week. 3 days a week, I actually work in a MSK pain management clinic. So yesterday was that. And they're a little different. So today for family practice, it's just a regular 9 to 5 day. Get in. I try to come in a little bit earlier. I go through some of the inboxes, some of the results or other communications I have with various other physicians, making sure there's nothing urgent, that I follow up on all the paperwork, the administrative work. I just go through it all. And then I just go see my patients. And the patients can be anywhere from I have pain here and there, refill medications, mental health things, prenatal visits, infections, just the whole gamut. And of course, in the family practice, I would do procedures that a lot of family physicians do, such as toenail wedge resections, skin biopsies, simple sutures, IUDs, pap tests, just those things like that. So that's what I do in my family practice most of the time. In my pain practice, again, it's a referral basis. They need to get referred to see me. And in that place, I do a lot more procedures. So anywhere from trigger point injections to ultrasound guided nerve blocks, prolotherapy, PRP, um, various joint injections, soft tissue injections, things like that. So those are the patients I see. Now in Canada, on average, in my family practice, I do see up to 40 patients or sometimes more in a day. In the procedural clinic, it's a little less than that. But in my family practice, 40, 45 patients easy in a day.
Okay, so let's take it all the way back here, Dr. Wu. Where did you grow up? What sparked your interest in medicine? Why did you decide to become a doctor? And especially with your journey leading up to practicing in Canada.
So I actually grew up in Canada. I grew up first on the east coast of Canada and then west coast where I am right now. I did most of my secondary school and upper education here in the west coast. And I guess what drew me to medicine was it started off with a love of sciences and biology. I think that's where it came from. And I wanted to be in a position where I could give back to the community. I just loved helping out, being of servitude to others. And I think that's where my interest in helping others came from. And medicine was just a calling, I guess. It felt like a calling. At one point, though, I did go soul searching, and there was a point in time where I wasn't sure if medical school was what I wanted. So I was really debating between medical school and being a clinical psychologist. So I was really debating those two. And ultimately, I chose the medical route and never looked back.
Beautiful journey. Where did you go to undergraduate school? Was there anything there that particularly steered you towards medicine? Did anything stand out to you about osteopathic school, perhaps influencing your path?
Yeah. So I went to the University of British Columbia, which is here in Vancouver. Actually, it was my time at UBC that made me go soul searching, as in I'm not sure if the medicine is what I wanted to do. Yeah, just I think it was the constant because my undergrad degree was not I didn't do pre-med for undergrad. I did cell biology and genetics. And I think that's when I was unsure if I really liked the hardcore sciences as much. I did take a few elective psychology courses and I loved it. I loved that. I loved abnormal psychology, which is their field of, psychological, the pathology, right? Various types of degrees of depression, anxiety, borderline personality, and just everything like that was so fascinating for me. And that's why I was considering clinical psychology at one point. Right. So actually, it was my time at undergrad that almost steered me completely to psychology more so than med school. But even though I was focusing my time more on psychology, I think at the back of my mind, it was that constant yearning to that initial love I had for biology and science. I think that was still there, and I just couldn't drop it.
Hmm.
So that's when I was doing research to figure out what I wanted to do with my life. Back then, obviously, all I had was Google and various forums. So back then, there was the Student Doctor Network. The SDN was a forum back in the day. I think it might still be around. And I was searching through various options, and I kept seeing the word DO pop up. Before that, I had no idea what osteopathy was. I had no idea there was such thing as osteopathic medicine. And then I wanted to find out what this DO business was. So the next thing I did was looked it up on Wikipedia. And, I read it, and it seemed very interesting. The whole point that you do medicine and you get to use your hands. Wow, that was that seemed very interesting to me. And I always enjoyed using my hands. Oh, I guess I forgot to say, my one of my biggest hobbies back in the day was being a magician. I did a lot of magic shows and things like that. It helped pay through part of my college and university and things like that. So
That
the whole point of doing sleight of hands and everything like that. So I loved using my hands. So the thought of, oh my gosh, I get to use my hands, that was my wow. So I read more into it, and I felt like it resonated more with what I wanted to do. The philosophy of it was different from regular allopathic medicine. And I guess that's what really attracted me more towards osteopathic medicine.
that's awesome. Between the gap of when you said you had a hobby and when you said you were a magician, I thought to myself, this is going to be good. So, what drew you to the specific program you chose? And how did that decision connect to your eventual practice in Canada? It's interesting how life's opportunities arrive in such mysterious ways.
Oh, absolutely. So I think when I started medical school, I knew I wanted to do family medicine. I think I came in wanting to do family medicine just because felt like that was the best way I could serve the community more. So right from the get-go, I knew family medicine. It was in fact during med school, that's when I really started to consider maybe I want to do neuromusculoskeletal medicine, NMM. So there was a lot of back and forth in my mind all throughout med school until year 4. And the reason why I ultimately chose FM, so I did my +1 afterwards. I did do a +1. So uh, the reason why I chose FM first and then decided to do ONMM afterwards was because of AT Still's story, how he was a physician first, and then that's when he started to incorporate more as he was developing osteopathy. And I felt like that was a good balance. That's the way I really wanted to do. Be able to be really familiar with allopathic medicine to know when it's appropriate to include osteopathic medicine and how it could complement each other and really give a full spectrum of care and support for my patients. So that was why I chose the whole FM and +1 pathway. So when I decided to go to residency, I wanted a residency program that was a little more rural and not so urban because I wanted to do more, right? I wanted to be in a position where maybe there won't be too many specialists around, right? In a place where the resources might be a little more scarce than a big urban setting where more responsibilities may be on the family doctors to be able to do some more things. And those were my thought process. So I chose a residency program called Guthrie in right at the border of New York and Pennsylvania, northern PA region. So one of the reasons why I chose there again was because they were really, really open to osteopathic medicine as well. They had their osteopathic recognition, and just talking with the program director, he seemed very excited and wanted to incorporate more OMM. So that's what really drew me to there. And I loved it. I learned a lot. And just like the program director promised, there were lots of opportunities to do OMM there as well. And then after that, to do my +1, I went to Maine, Bangor, Maine, to do my +1 in ONMM part of my program, my training. The reason why I chose there was because they had a good incorporation of sports medicine where you would see a lot of athletes, which was always interesting to me. And also they had access to a dissection lab where you could also dissect cadavers again. So that's the
All
reason
right.
why I chose that program.
Yeah, so it sounds like you had an idea of what you wanted and you sought out the opportunities to make it happen for yourself. When you were in osteopathic school, did you get involved in any sort of unique extracurriculars, any sort of research? Was there any key people, maybe some friends, professors, or mentors who shaped your time there? And where'd you do your clinical rotations and how did that influence your path?
So when I was in medical school, probably the club I was um, involved in the most was the SAAO, the Student American Academy of Osteopathy. I loved every moment of it. I loved being part of it. I loved going to convocation where they do, it's their osteopathic conference in the States. Unfortunately, I couldn't be there right now, but yeah, I loved being part of that the most. I think there were a few teachers, professors there who've definitely shaped me. There were a few family physicians who, you just meet and you shadow a doctor, and the first thought that goes to your mind is, wow, I want to be like him. There were a few doctors like that. Other doctors who were my OMM professors. Again, it's like, wow, they know so much. How do they know so much? I want to be like them. Definitely shaped me, my urge to know more, to become a better version of myself, to be able to emulate them. That's why I think it's so important to have role models, a mentor, someone that you can look up to strive to become better.
Certainly. I agree 100%. A good mentor can be very powerful.
Absolutely.
So once you finished up your residency, how did job hunting go?
Oh, yeah. So once I finished so my plus one. So once I finished my plus one, I wanted a little more experience being independent. So I actually worked at there was a walk-in urgent care there. I worked at for a little bit while I was finishing up the process of trying to go back to Canada. And it wasn't so like I said, there's a big shortage of family doctors in Canada. So it's really not hard to to find a job. There's places hiring everywhere. So yeah, I just found a clinic that was hiring and who would be okay with hiring a brand new American trained doctor to be there. And I just started working right away. So I think after I stopped working at the urgent care and when I started working at Canada, I think there was maybe a week and a half gap. I started working right away. Finding a job as a doctor in Canada, it's not difficult.
So what have been some of the upsides and downsides of your chosen place of work?
So I think getting used to the culture of medicine in Canada was definitely a challenge. Being able to see having to see, 40 plus patients in a day, it's you do have to limit how much discussion, how much, talking I do with my patients, which was very difficult for me. In the States, when we're trained in family medicine in the States, office visits are what, like 20 minutes? Easy. 20 minutes is probably some of the shorter ones I had, where you get a full history, you discuss multiple things, and things like that. But in Canada, there's a time limit. That's probably the best way to put it. There's a time limit to how many patients, how long we could spend time with a patient, because that would cut back on time we could spend in the subsequent patients and the subsequent patients. So there are many physicians in Canada who limits discussions to only one problem each visit. That's how some doctors up in Canada, they spend only 5 minutes per visit, maybe 10 minutes per visit. So that was a cultural shift in medicine that I had to get used to. And to be honest, I'm still not used to it fully.
Yeah,
That was definitely a difficult thing. But luckily, medicine is medicine, no matter where you go, right? What a beta blocker does in the States is going to do the same thing up in Canada. The medicine itself doesn't change. So that was definitely a big hurdle that I had to um, get over in Canada.
most definitely. I could see how that could be challenging adjusting to such a cultural shift. But on the flip side, what do you think is one of your most unique strengths, perhaps consider it a superpower that helps
Mhm.
you
Sure.
succeed as you practice in Canada?
Honestly, it's probably what I learned from OMM. It does give me a totally unique skill set that other physicians here don't have. Like, I'm generalizing this a lot. There's two big reasons why someone would go see a family doctor here. Two big reasons. Like acutely, pain and pus. I call it the two P's, the pain and pus. So especially with the pain portion of it, it gives me another tool of being able to diagnose someone very quickly. You have so and so somatic dysfunction going on right now. And if it's a very simple fix from their history and from their physical exam, sure, I'll do a quick muscle energy. Sure, I'll do a quick HVLA, counter strain, whatever. Cure their problems, right? Fix their problems. So that kind of tool set really does help me here quite a bit. Not only that, but the osteopathic training of, we talk a lot about in the philosophy of osteopathy, there's a lot of discussion about the whole mind, body, and spirit, right? And I think having that kind of training and having that kind of approach when dealing with patients gives you a different appreciation for some of the things that they may be going through. And that I believe some of my patients appreciates a lot. Because if someone has problem A, if they have pain here or something's going on, it's not about just treating that, but being aware of how that could be affecting different parts of their life, whether it be their mind, their body, and their spirit, and being able to address all of that, I think is an opportunity that I'm really given here as a osteopathic family physician. And it's not, if I can't discuss everything in that one visit, sure, I'll have them come back very soon afterwards, and there's no financial burden for a patient to do so, so that I can make sure that they get healthy, that they're well taken care of.
Well, it's great to hear that your osteopathic training has been of such use in your day-to-day practice. That's a
Absolutely.
great thing to hear.
Absolutely.
So, Dr. Wu, what's some of the best advice you've received throughout your journey, whether it's all the way back to grade school, perhaps undergrad, med school, residency, or beyond? Piece of advice that stuck with you and could add some real value to our listeners, especially those maybe who are eyeing family medicine in Canada.
Oh, absolutely. So I was thinking about that for a few days. It's a great piece of advice. What's something that one of my mentors have told me that was really eye-opening? So this can be taken in many different ways, but I'll tell you the way that I took it. So what it was is don't let your grades interfere with your education. We're all here to be physicians. We're all here to be in a place of service for our patients. And only strive, and I'm not saying grades aren't important. Absolutely, they're important. But we want to make sure that we are enjoying what we're learning and we are really getting well educated with what we're being taught and not only striving to have the best grades. I think so. Basically what I'm trying to say is being able to put your heart into it to really be able to practice the art of medicine, the art of osteopathic medicine. I think that is very, very important.
That's a great piece of advice.
Yeah, but some listeners may want something more practical. Something for more practicality, definitely just always be able to question everything, right? Don't take everything for, even if your instructors or your professors say something, question it. Question it. Do your own research about it. Whether it be something you learn about in osteopathic OPP class, question it. Do your research on it. Learn or try to learn more about it. Or whether it be something that you see in your clinical rotations, read about it, learn about it. Always have a hungry mind to learn more, to strive to become better.
Absolutely. I love it. Don't let the grades get in the way of your education and never
Yep.
let go of the relentless curiosity.
Yeah, always dig on. That's what DO stands for. Dig on.
Well, Dr. Wu, thank you so much for your time today. Appreciate you
Thank you.
sharing your advice and your experiences and your journey. Thank you very
Thank
much,
you.
sir.
Thank you so much.